an approach for a pelvic floor release, pelvic diaphragm release. Again, we're going to be using the ischial tuberosities as major landmarks. In this case, going to find your thumbs along the posterior surface of the ischial tuberosities, which is usually going to be found right at the bottom fold between the glutes and the hamstrings. You're going to follow very tightly along that bone as you go medially and along into that fossa. There is a lot of loose tissue in there. There's also the area where the pudendal nerve will be hanging freely in there for pudendal nerve blocks. In this case, I'm going to slide both thumbs flat, find the inferior surface of the ischial tuberosities, go along the surface of that bone on each side into that fossa, and then the tip of your thumbs will be going into that fossa and feeling as they take a deep breath in and out. They'll feel the pelvic floor push into the tip of your thumb. You're doing effectively a direct inhibition along there, as well as a muscle energy treatment or a myofascial treatment, depending on what you do with the rest of their body. You can direct this somewhat medially superiorly or laterally superiorly to affect a change in that pelvic floor. For myofascial, you can also start adding other vectors where you can think about doing some separation of your thumbs from each other along the inside of the ischial tuberosities, or even taking that whole floor and moving in a slight clockwise, counterclockwise direction. For muscle energy, you would have your thumbs in the same place, but again, you could place yourself in between the patient's ankles, as described in an earlier technique, and have them push their ankles toward you. So you could be here in that same position and ask them to go ahead and push their ankles together and relax.